In this lesson, we are going to talk about model cards, and your warm-up journal prompt is: imagine you are babysitting a young cousin and they run up to you from playing, looking upset and asking for help. They show you that they skinned their knee and it isn't bleeding, but it's very pink. If you had to choose one way to react, which would you pick? Would you 1, tell them to deal with it and go back to playing? 2, tell them to wait a minute while you go get some Band-Aids? Or 3, call 911 and ask for an ambulance? I want you to put your answer to that in your journal. Now, pause the video here so you can do that. This situation is vague, and most of you will probably say either number 1 or number 2. Number 3 may seem like a very unrealistic way to react to the situation. There are plenty of other choices that we could make, but the situation doesn't provide any additional context that might be important. For example, maybe the location where they were playing has an important role in the decision that we would make. These feelings are valid, and they can lead to a nuanced conversation about how difficult it is to make decisions without full context. All right, so what kind of injury would lead you to make a different choice? So if you chose number 1, to tell them to deal with it and go back to playing, what kind of injury would have you make a different choice? You're also going to put an answer to this in your journal. Think about what kind of criteria would have you make a different decision. If there's blood or not, how much blood, whether or not your cousin is crying. What about whether or not your cousin is conscious? If they're unconscious, you might be calling 911. There are really a wide variety of details that really affect what our decision would be. A lot of different features. Well, the same thing can happen with computers too. The decisions that it makes can be different from the ones that we expect, even in very similar situations. And in this lesson, we're going to look at how we can test a computer model to see what kinds of decisions it's making and make sure that those decisions are fair. Our question of the day is: how can we evaluate machine learning models once they've been trained? First thing you're going to need to do is download your activity guide for model cards, so that way you've got that handy. And we are going to go to code.org, Lesson 8, Level 1. This is a medical priority app. In this app, let's look at what information it is asking for. Okay, a hospital hired a company to create an app to help prioritize patients when they come in. The app uses a machine learning model that is 80% accurate. The model was trained on data from 1,000 people who entered an emergency room in June 2020. Interesting. Our job is to test the app and see how it performs when new people enter the hospital. So let's look at how this app works. Okay, follow the instructions on how to test the app. So let's go ahead and hit run. Put your age, your race. Okay, are you bleeding? Yes. Shortness of breath. Yes. Areas of pain. Let's say limb. Well, let's say head. Pain type. Sharp. Sign in. Thank you. Your priority is priority. What? Okay. This is how the app works. And if we were to run it again, choose something different. Let's say over 60. Let's choose anything. Oh, priority is return later. Interesting. Okay, play around with it and see what kind of answers, what kind of responses you're going to get. While you're playing around with it, think about this. Try to find a person that would be admitted as priority, a person that would be admitted as normal, and a person that would be admitted as return later. Okay, so pause the video here, play around with it until you can find someone who would be those people. Okay. What features led to priority recommendations, and did that recommendation seem to make sense? I want you to put your response to this on the unit discussion board. So here's our second prompt. The hospital wants to check the results under very specific situations. If we were in the classroom, we would split into 4 groups, and each group would check a specific person. So, and this is what I want you to do. If you are a senior, I want you to check on this group. If you are a junior, I want you to check this group. If you are a sophomore, 10th grade, check on group C. And if you are a 9th grader, check on group D. Okay, put your results in the discussion board. Pause the video here so you can do that. What were your results? Put those on the discussion board. Here it says that we're going to change things just a little bit. So we're still going to stick with who is doing which group, okay? Seniors, juniors, sophomores, freshmen. Make these changes to your requirements, to your check-in sheet, your sign-in sheet, okay? And see what your results are. Make a note on the discussion board that this is 2A and not 2, okay? So put your results on the discussion board. All of the results changed based on just those 2, well, not 2. All of those results changed based on what you changed. So do those changes seem like they make sense, or do some of them seem unfair? I want you to also add that to your discussion board post. So what you can do for your discussion board, put your results for prompt number 2, and then put your results for prompt 2A, and then put whether or not you feel like those changes make sense or if they seem unfair, okay? And just from looking here, are you bleeding? No. Shortness of breath? No. Sharp head pain. Stabbing chest pain versus stabbing limb pain. I know the difference in this could be a heart attack. So that may need to be addressed immediately. Now, before this was changed, this was a priority. After the change, it's a return later. under 18 white female who is bleeding with no shortness of breath and head is hurting with throbbing pain. If he were a white male, he would be a priority, but now that she's a white female, she can just return later. Does that make sense? Is that fair? Those are things that we want to discuss. So it's a good thing we were hired to investigate this app because it looks like we've uncovered some disturbing trends in how it was designed. We've now seen a few situations where the app is making different decisions based on your personal information rather than the medical condition you're in. For something as important as a hospital visit, this is unacceptable. This is an example of how machine learning can be biased.
Machine learning is only as good as the training data you put into it. So it's super important to use high quality data and lots of it. But if data is so important, it's worth asking, where does training data come from? Often, computers are collecting training data from people like you and me without any effort on our part. A video streaming service might keep track of what you watch, then it can recognize patterns in that data to recommend what you might want to watch next. Other times, you're directly asked to help, like when a website asks you to spot street signs and photos. You're providing training data to help a machine learn to see and maybe even one day drive. Medical researchers can use medical images as training data to teach computers how to recognize and diagnose diseases. Machine learning needs hundreds and thousands of images and training direction from a doctor who knows what to look for before it can correctly identify disease. Even with thousands of examples, there can be problems with the computer's predictions. If X-ray data is only collected from men, then the computer's predictions may only work for men. It may not recognize diseases when asked to diagnose the X-ray of a woman. This blind spot in the training data creates something called bias. Biased data favors some things and deprioritizes or excludes others. Depending on how training data is collected, who is doing the collecting, and how the data is fed into the computer, there is a chance that human bias is included in the data. By learning from biased data, the computer may make biased predictions. This can happen whether the people training the computer are aware of it or not. So when you are looking at training data, ask yourself two questions. Is this enough data to accurately train a computer? And does this data represent all possible scenarios and users without bias? This is where you as the human trainer can play a crucial role. It's up to you to give your machine unbiased data. That means collecting tons of examples, often from lots of different sources. Remember, when you pick and choose data for machine learning, you're actually programming the algorithm using training data instead of code. The data is the code. The better the data you provide, the better the computer will learn.
Having a biased model is clearly a problem, and it's another reason our role as evaluators and testers of machine learning models are so important. This is a problem that people in the machine learning community are trying to solve. Let's listen to one possible solution, then we'll talk about how we can use this idea when creating our own machine learning models. A key vocabulary term for right now in this lesson is bias, when a decision favors some things and deprioritizes or excludes others. All right, let's listen to this example.
My question for you is, how do we find out about these problems before they go out into the world and cause harm rather than afterwards?
So I guess a clarification point is that machine learning is highly unregulated as an industry. These companies don't have to report their performance metrics. They don't have to report their evaluation results to any kind of regulatory body. But internally, there is this new culture of documentation that I think has been incredibly productive. I worked on a couple projects with colleagues at Google, and one of the main outcomes of that was this effort called model cards. Very simple, one-page documentation on how the model actually works, but also questions that are connected to ethical concerns, such as the intended use for the model, details about where the data is coming from, how the data is labeled, and then also, instructions to evaluate the system according to its performance on different demographic sub.
So we didn't watch all of it. All right, this is a Vox video about possibly automating racism. We didn't watch all of it because that portion is the most important part, because we are going to start looking at model cards. And this is where you need your activity guide, which is an example of a model card, and you will need to go to Code Studio. So what you're going to do is fill in the remaining boxes about the book recommendation model. Some questions to consider are: is there enough data for this model to be used as intended? Does the data represent all possible users and scenarios? You're going to fill in your model card. What's the intended use of the book recommendation model? Okay, what's it trying to predict? What are the limitations and warnings of this model? All right, and then you have, that's going to be the first part. Pause the video here so you can complete the first page. Even though we discovered bias in our original model, there is still a need to help nurses and medical professionals in the ER. Several other companies have created medical priority models that can be used to replace the biased one that we discovered. They've also sent along the model cards for us to evaluate. Look at these model cards and let's see if we can find a model that we would recommend to the hospital to help decide medical priority. So we're going to continue levels 3 through 5 on code.org. Go through each level and look at the model cards, then record your recommendation on your activity guide. So on page 2 of the activity guide, we have level 3, ER Recommender V1, version 1. Would you recommend that this hospital use this model instead? Why or why not? Be sure to refer to the model when making your recommendation. So if I were going to recommend the current model that we looked at earlier, I would say I would not recommend this model card because it deprioritized a person based on their race. And then I would say when the person's race was Asian, they were considered a priority, and when the person's race was AIA or whatever it went to, it deprioritized them. Okay, so you're going to give specific examples as to why or why not you would recommend the model. Pause the video here so you can complete that. Would you recommend the model? Why or why not? I do want us to look at these together because we're going to be seeing some more in the future. We're on medical dataset model cards. So we have our model card that looks like this. We have the label and then we have the features. This is the first model card, the V1. Intended uses, limitations. This model shouldn't be used in a way that could reduce the care for people entering an emergency room. 33% accuracy. That is horrible. Okay. Weight ranges of the patient. It asks if they're bleeding, shortness of breath. All right, this is Northern Lights ER priority. About the data, the source was Anchorage, Alaska Hospital. It's a remote hospital in Alaska. Features and labels predict priority based on temperature, sports, and cause. Sports include no sports, others, ice skating, snowboarding, skiing. The cause, frostbite, tree chopping accident, bear attack. 88% accuracy though. but again, Alaska, okay? And then our third model, AI Medical Recommender. The source is a U.S. hospital. The size of the data is 10 rows. It is going to recommend with 92-ish% accuracy based on those features. So, which of these would you recommend? Which would you not recommend? Pause the video here so you can complete the activity guide. For your wrap-up journal, if you could offer guidance to these companies training machine learning models, what advice would you give them to help create useful and unbiased machine learning models? Pause the video here so that you can answer this question in your journal. Our question of the day, how can we reevaluate machine learning models once they've been trained? Answer that in your journal too. And I want us to go back. I'm going to tell you what I think. 33%. That's horrible accuracy. I would not recommend this model based on 33%. Plain and simple. How could they improve this model? Because it seems pretty good. It's coming from a U.S. hospital. It's got 1,000 rows of data. It needs to predict priority based on bleeding, shortness of breath, weight, and area of pain. How can it increase the accuracy? All right, 88% of data. This model has features that are very specific. If you look at the data information right here about the data, it was trained in a rural hospital in Alaska. And this means that it probably won't do very well outside of Alaska or in other areas that are more diverse. For example, this is not going to do well in Mississippi because, one, there's water skiing, but that's not the same. There's no snowboarding here. We don't have ice skating unless you're in an ice rink. And then no sports. So why is sports even a category? I would not recommend it based on that. Okay. And then this model only trained 10 rows of data, or essentially only looked at 10 people that went to the hospital. So even though it has a high accuracy, it probably doesn't have enough data to be able to handle a real world scenario. So it's just not realistic. There are two terms that revolve around data, and that's qualitative and quantitative. Qualitative involves the quality of the data. Quantitative involves the quantity of the data. So you want your data to be both qualitative and quantitative because that makes the best data. So this data right here is only qualitative, which is why the accuracy is so high. It's not quantitative. What we would want is this data, this quantitative data mixed with this qualitative data, and hopefully that would give us a really high, it probably wouldn't give us a really high accuracy, but we would want something this high, but with the quantity of the first model. So don't forget to add the word bias to your journal, and that's all.